And welcome back, Santa Clarita. We're here, Providence, Holy Cross Health Hour, and we're joined today, a very special guest, interventionalist, radiologist extraordinaire, Dr. Greg Perrone. And, we just got finished chatting, gushing, if you will, about all the fine things about Holy Cross that we see and what we've had the opportunity to be lucky enough to be a part of, but including the advances that have been going on as far as interventional radiology, a lot of the changes within the technology for diagnostics in general. And I found as a practicing physical therapist that patients oftentimes will ask, what would be the best view to look at this, or why would they do that, and why would you do contrast versus not contrast, and if you would have the opportunity to do a CT versus an MRI, when would you do what and how and however, and having taught imaging at Cal State Northridge's physical therapy program, we now have the expert with us to be able to go through all of this. And Dr. Perrone, so X-ray, all right? We know we can see bones.
Yeah, X-rays basically are photons that pass through the body, and they get absorbed by different portions of the body differently, and it generates an image. I mean, X-rays are the most commonly used imaging modality that we have. They're used for any one of a number of reasons, to look at fractures, pneumonia, heart failure, person has shortness of breath, some type of injury, pain. We just use it it can be used for any body part. There's really very little radiation, no real major side effects. It's relatively inexpensive. It's very available and applicable to pretty much all body parts, like I said. So we have a number of different modalities that we deal with radiology. We have X-ray and fluoroscopy. We have CT scans, MRI scans, ultrasounds, nuclear medicine and PET scans, and then we do interventional radiology procedures. And a lot of these different modalities are complementary to one another. And again, that's coming back. That's why it's very valuable to have close interaction with our clinicians to determine what is the best test to order on a particular patient when you are looking for something very specific. It's very easy just to do a CT scan or an MRI scan, but if we're looking for something very specific, we have a very close interaction with our clinicians and emergency room physicians, and actually all the physicians, to determine what is the most appropriate test to order on a particular patient looking for a specific abnormality. And again, these tests are complementary.
And I remember hearing these conversations when I was with you in radiology, where the doctors would be coming in and saying, hey, listen, this is what I think is going on,
right,
and what would be my best, or what would be the best option to be able to get that the appropriate diagnosis. And so
well, that's one of the things, again, about Holy Cross that's valuable, because it still has that community feel to it, and there's a real close interaction between us and radiology and all of the physicians that practice there, that we have that interaction and that alignment to try and determine what's the best thing to do. We have a very close communication with them. I think that in some hospitals I've seen, this is lacking, and I think that's one of the things that I value most about Holy Cross, is that interaction.
And that allows for more expedient care, I would assume, that you're going to be able to derive a diagnosis that everyone feels the most they can support to be able to put a plan of care in place.
Yeah, absolutely. We're very, Holy Cross is a very busy hospital. We have a very busy trauma service, a very busy emergency service, and I must say that I think that our emergency room is really quite a magnet for patients, because our emergency room physicians are excellent. They do a very good job of taking care of the patients, getting them in a timely manner, and getting the appropriate studies ordered. And again, we have a close interaction with them. That's very, very important, I think. And again, as healthcare evolves and the emergency room gets busier and busier, and as the hospital gets busier and busier, particularly as we approach flu seasons and whatnot, that efficiency, that cost-effective utilization of services becomes of paramount importance.
Right. Right. And being able to do the right thing right off the bat is going to help with that.
Absolutely. You don't want to do repetitive tests. You don't want to do the wrong test that really doesn't show you what you're looking for. And again, that interaction is most helpful.
Perfect. Yeah, and here in Santa Clarita, I'll tell you, one, extremely active community out here. Lots of sports. We were talking off air. Justin, our board op here, he's who just slays it on a regular basis with us. He is following a lot of the sports and that's going on, and I can imagine the urgent cares in the hospitals, radiology and imaging specifically, with all the football and the such. Now this time of the year. We're going to see an uptick of that, and I think in the emergency room, especially Friday nights around 10 o'clock or so, we started noticing a lot of people in pads and helmets walking around. And as far as it goes, now fractures, X-rays probably the best.
Fractures,
for starts.
X-rays, that's correct. Sometimes fractures can be difficult to visualize just with plain X-ray, and again, that depends upon the clinician's index of suspicion, and oftentimes we'll do a CAT scan to help either delineate the fracture more clearly or define the extent of it, to help the orthopedic surgeon, for example, determine what's the best way to treat it. Sometimes findings are a little bit more subtle, and we have to use, or they may be not necessarily bone-related injuries, but they may also be soft tissue-related injuries, and that's where MRI scans are really helpful, because they can make that soft tissue differentiation better than anything else.
So Adrian Peterson, when he went down on Sunday, his MRI that was able to demonstrate the meniscal tear would have been a lot better to, right off the bat, just go to it if it seemed appropriate at the time.
Right. Many years ago when I was training, we did a lot of arthrography. And it wasn't a bad procedure at all, but it's been pretty much supplanted by MR. Now, sometimes we do inject some contrast material into the joint space to define things more clearly in shoulders, knees, ankles, whatever joint we need to look at. But it's still, as a general rule, MRI scan is a non-invasive test, and it gives you the best soft tissue differentiation. It would be hard pressed to see a meniscal tear without an MRI scan these days.
Right. And with that, I've noticed too that MSK ultrasound is being used a lot more, has been finding its way onto the fields now as well. And what types of things might we be able to see by utilizing an MSK ultrasound?
Ultrasound we can use it for looking for the rotator cuff specifically. There's other just soft tissue types of injuries that we can use it for, looking for soft tissue masses or whatnot. But in an injury setting, I think that's the beauty of sonography or ultrasound, is its portability. And they do make ultrasound units now. I know because I used one in Greece that is really about the size of an iPhone. And you can do a lot of interesting things with it, and again, it's portable, it's very safe, there's no radiation involved with it, you can use it for a lot of body parts. So still, I think MRI is still the premier
standard
way to evaluate joints in general.
Now, it was interesting that you mentioned use of CT scan on maybe fractures that may not be clearly delineated on X-ray. And I remember when Holy Cross received their first spiral CT, and I was intrigued with its ability to build a 3D mock-up of what the skeleton actually looked like. And technology-wise, that continues, right?
Absolutely. What we can do with CT is pretty remarkable. We can get CT is kind of like X-ray, and basically you have these a number of X-ray beams and a set of electronic detectors around you that measure the amount of radiation absorbed by the body. The computer programs generate a 2D image, and the software programs can generate a 3D image. That's very valuable to us, particularly in these injury patients, and just looking just in general in the body. I think it's CT as a modality is just incredible. I mean, it's fast, it's accurate, it's simple to use, it's very cost effective. There's no real side effects that are associated with it, immediate side effects. One of the problems is because it's such a wonderful test, oftentimes it gets overutilized. And there is a significant amount of radiation from a CAT scan. People don't realize it, but the amount of radiation from a CAT scan of the chest can be upwards of the same amount of radiation from several hundred chest x-rays. And so we really don't want to overutilize it. And I think that's one of the things that's coming in kind of on the horizon in diagnostic imaging is that whole aspect of radiation safety. I think one of the newer things that's coming around is these phase contrast X-ray imaging, which really can decrease the amount of radiation 10 to 100-fold.
Wow.
There's been a real push for monitoring patients' radiation dose and keeping track of it. And we're very sensitive to that at Holy Cross. We always try to use the absolute lowest amount of radiation possible. If we know that patients are having too many CTs, we will call the clinician that's ordering the study to say, hey, are you aware of this? This patient's had this many CTs. What exactly are we looking for? And we really try to tailor these exams specifically to the things that the physicians are looking for.
And it's that whole concept of individualized care. We're not recipeing it. We're actually taking a look at each patient as an individual to assure that what we're doing is the right thing.
You know, that's very important. I mean, I think that we can get, you know, in today's medical environment, it's very easy to lose sight of that individuality. And we've really tried in radiology, and I think Providence in general really tries to maintain that relationship with our clinicians to just do exactly what is necessary and what's the best test.
Right. So gosh, we've got X-ray seems to be a standard imaging. CT gives a great representation, generalized representation of what's kind of going on with the body. MRI, a wonderful, very clearly delineated look at what's going on inside soft tissue-wise, as well as bone. Now, you talked briefly about PET scan.
PET scan. Well, PET scans.
We hear a lot about that now.
Right. PET scans fall under the realm of nuclear medicine. It's one of the other things that we use. And nuclear medicine tests often will look more at the functionality or the functional components rather than just the structural components. CTs and MRIs provide incredible delineation of the anatomic structures. MRI is superior to CT for delineation and differentiation of different soft tissue structures. Okay, but nuclear medicine in a nutshell, we use a small amount of radioactive material. There are different types of radioactive tracers that we use for different organ systems or different disorders that we're trying to diagnose. These tracers can be given orally, intravenously, intradermally, or in the skin, intrathecally, or into the spinal canal, and they can even be inhaled. And the specific tracers will accumulate in the organs that we're specifically trying to evaluate. That radioactive material then gives off energy in the form of gamma rays. We measure that with a camera or a probe that detects that energy. The computer programs generate an image with that, and it helps to really assess the function. PET scans we use primarily for cancer detection and determining the response to treatment of cancer. That's really where we use most. There's a lot of other uses for it in cardiac and brain, but this is where I would say the vast majority of uses for the PET scans are. At our imaging center, or the Providence Holy Cross Imaging Center in the Santa Clarita Valley, we actually have a CT PET scan there. We were the first ones in the Santa Clarita Valley that had a CT PET scan there as well. So
it's tremendous, and with our most recent joining of forces with City of Hope, I can only envision, because they're going to have a very strong presence with Holy Cross and in the Santa Clarita area, that the need for PET scan potentially will begin to grow.
No, not will begin to grow. It's already grown significantly. Yeah, we've seen Holy Cross. Tom, you've been here a long time.
Yeah.
As have I, and I have seen the change in the ordering of imaging studies and the volume of imaging studies that are ordered increase dramatically. And it's a challenge for us in radiology and for Providence Holy Cross to keep up with that volume and make sure we have the resources available to do it. We try to do it. We have plans we do have plans on the table to continue to increase our department and get newer equipment and whatnot, but it is a challenge. It is a challenge.
Yeah, and it's funny, you talk about in the future, and I was intrigued again with the idea of the 3D structures that can be pulled from our CT scans, and that I'm wondering that somewhere down the line, will we be using the 3D structuring from our CT scans so that way we can 3D print new parts? Is this something that's actually happening? I want 10% if it's not.
Well, but you know what? From a different perspective, looking at it from a different perspective, we actually are in the process of purchasing a new piece of equipment for our interventional radiology portion of the practice that does have a CT component to it, and this is very valuable, particularly for our oncology patients, and particularly for our affiliation now with City of Hope, in which case we can do treatment through catheters into the blood vessels, and we can see it more clearly with the CT scanners, coupled it with the angiographic component of it, in order to deliver chemotherapeutic agents or particulate matter to tumors in very specific locations.
As opposed to doing it in the systemic sense.
Correct. Yes, that's correct. We can be very, very targeted in our approach, and you know what? I think that's a very it's another piece of our equipment to help our patients.
Right, and that's going to improve. I mean, if you can go through such an experience, but I mean, it's going to improve the experience of the patient.
Well, it's going to help.
Well.
Yeah, not only improve the experience of the patient, but also help take care of them. It's a challenge for hospitals to stay up with the current changes in the medical environment, let alone stay on the leading edge of things.
Right. Right.
And again, this is where the foundation of Holy Cross has been really, really helpful. So. Yeah,
and I in a previous life, working with an orthopedic group, I had the opportunity to witness just what type of expense it is to try to purchase these types of machines. We were looking at used, not that this is going to mean anything to anyone out there, but used 1.5 Tesla MRI units that we're going to be running probably close to $1 million, and that if you wanted to upgrade it to a 3.0 Tesla, which seems to be where research is now looking at, that you're looking at sums that are probably 4 or 5 figures. And so the expense to be able to have this type of machinery and technology available for patients that will allow us to even be better, it requires help. And I think that's where that strength of the foundation really comes in, and to assist in bringing that type of equipment that will allow us the opportunity to better care for the patients.
Again, I think the interaction between the foundation, the clinicians, and the administration at Holy Cross is particularly strong. And again, being involved with all aspects of that, it's been a very good experience for me, I mean, professionally and personally, and I think it's been very helpful for us to know the direction that the hospital is going and things that they need to do to continue to provide that quality of care to the patients.
Exactly. And guys, we're with Dr. Gregory Perronnet, radiologist with Providence Holy Cross here on the Providence Holy Cross Health Hour. We are just moving into our next commercial break, and we'll be kind of wrapping things up for you. We're here at KHTS, 1220 AM, your hometown station. We'll see you in just a few minutes. And welcome back, Santa Clarita. We're just going to be wrapping up the Providence Holy Cross Health Hour. We're joined today with Dr. Greg Perronnet, a radiologist with Providence Holy Cross Medical Center. And while we were on break there just for a short period of time, we were just having a quick chat as far as turnaround time, if you have an imaging study done, how quickly is a radiologist actually getting to it to be able to do the read and the such, and just availability of the radiologist. And it sounds like to me, Holy Cross has a radiologist available on site 7 a.m. to 10 p.m. However, am I understanding correctly that radiologists are available
Oh, absolutely. Even though
24 hours?
Absolutely. We provide coverage to Holy Cross 24/7, 365 days a year. We're physically on site from approximately 7 o'clock in the morning until 10 o'clock in the evening. After that, we still are providing the patients still continue to come to the emergency room. It really doesn't slow down at all. And we are still providing interpretation of x-ray services, all imaging studies throughout the night. If there's procedures that need to be done, of course, we're on call. We come in and we do those as well. Our turnaround times are typically some of the better ones in the entire Providence system. And if there's a finding on an x-ray that's either critical, and we have a whole group of critical test results that we adhere to, or something that's unexpected, we place personal telephone calls to our referring physicians, because that's part of, again, that gets back to that community feel about Holy Cross. We really try to maintain that line of communication between the referring physicians and us as radiologists. The use of radiology has increased dramatically over the past several years. I've seen it's just a change in the medical education system. I was on staff at UCLA for a while as a clinical assistant professor, and you can see that the clinicians, particularly the newer trained clinicians, and as the medicine has evolved, they rely very heavily on imaging to help them. And imaging does have a significant role in the care of a patient, and because they rely on it more heavily, we have to provide that service throughout the night. It's imperative.
Right, and there is something to accuracy, and what we find even with some of the blocks that we're doing, the peripheral nerve catheters that we're doing in surgery for orthopedic patients, the ability to utilize ultrasound to be able to assure that catheter is placed exactly where it needs to be is really assisting in our outcomes and the patient experience.
That's one of the beauties, I think, of ultrasound also, because there's no ionizing radiation. It's visualized in real time, so you can see and watch exactly where you're putting it, and you know exactly where it's at.
Exactly. And I think one of the big pieces that we'll want to know, is you need a prescription usually from your physician or from a physician in order to receive imaging.
Correct.
And as Providence Holy Cross, we are on panel with a number of the normal insurances, with FACE, with Healthcare Partners, and the such. And so oftentimes it will be our staff being able to assist when in the imaging needs, which is extremely good. But also here in Valencia, tell us about the facility. We have just about a minute or so.
Well, the Providence Holy Cross has an imaging center on the corner of McBean Parkway in Valencia, 26357 McBean Parkway to be exact. And at that facility, we provide MRI scans, multi-slice CT, and CT PET scans.
So it is really your advanced imaging stop as
Correct.
far as for Santa
That's
Clarita.
correct. We will have occasional ultrasound, but we really focus more on CT, MR, and CT PET scan.
That's fantastic.
It's kind of a nice referral center up in that area, and it's worked very well for us. It's been very, very busy. The volumes continue to increase there. We get a lot more referrals. It's a very easy, pleasant experience for patients. Sometimes going to a hospital, I admit I've had to do this personally, and particularly at university settings and whatnot, it's a very cumbersome, difficult process. And the imaging center in Santa Clarita is very user-friendly. People there that work there are very pleasant to deal with. It's a wonderful arrangement there, and if you need one of those tests, I would encourage you to keep us in mind.
Excellent. And we're just getting ready to wrap up. We want to make sure that if you needed to reach anyone with Holy Cross, it's really easy. 888-432-5464. And for those of you who still go off the Klondike 5 idea, it's 888 Healing, Healing. I'm Tom Burton with Providence Holy Cross. We'll see you next month for the Providence Holy Cross Health Hour. Thank you very much, Dr. Paranek.
Thank you, Tom. Thank you.